He falsified his research so that our DU-90 could be approved and Devlin McGregor could give you Provasic.
A trial that the National Institute of Allergy and Infectious Diseases, which is the institute I direct, sponsored, called the Adaptive Covirus Disease Treatment Trial, or ACCT-1, was started in February 21st of this year, and it was a randomized placebo-controlled trial comparing the Gilead drug Remdesivir with a placebo. It was highly powered with about 1,090 plus individuals, so it is the first truly high-powered randomized placebo-controlled trial. It was an international trial involving multiple sites, not only in the United States, but in various countries throughout the world, including Germany, Denmark, Spain, Greece, the UK, etc. The primary endpoint was the time to recovery, namely the ability to be discharged. When you have a study like this, we have a data and safety monitoring board which looks at the data. And they are independent, so there's no prejudice on the part of the investigators because they're doing the trial or the drug is from a certain company. The Data and Safety Monitoring Board on Monday afternoon contacted me on April 27th, first on Friday, the week before, and then again on April 27th, and notified the study team, namely the multiple investigators who are doing the study throughout the world, that the data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery.
Provasic.
The FDA has approved the antiviral drug Remdesivir as a treatment for patients hospitalized with COVID-19. This comes as more than 8.4 million Americans have tested positive for coronavirus since the start of the pandemic, and more than 223,000 people have died across the country. Remdesivir is now the first and only fully approved treatment in the U.S. for coronavirus.
Provasic.
So remember that Gilead had agreed to donate its existing supply of Remdesivir through the end of June. So now it is putting a price on that drug. The price for the United States is going to be $520 per vial, or $3,120 for the typical course of treatment. That is higher than in other developed countries, where the price will be $2,340 for the entire course of treatment. Gilead says that's because of the way the drug discounting system in the United States works.
Provasic.
There are safety concerns surrounding an FDA-approved COVID treatment.
WCPO 9 News reporter Jasmine Miner is live now to explain what this could mean for you and how the study could impact the pandemic. Good morning.
Well, good morning, guys. Yeah, it's called Remdesivir, and it's the only current FDA-approved COVID-19 treatment. However, UC professor and pharmaceutical scientist Bingfeng Yang tells me that the problem arises if a patient is taking that treatment and is already on other medications. So, for example, if you are taking medications for cancer and you go in and you take this treatment, there could be problems that arise. The professor tells me they found that Remdesivir permanently stops the activity of an enzyme called CES2, which is found in the intestine, liver, and kidney and is needed for the breakdown of many medications. So what does this mean? This breakdown means Remdesivir can cause drugs fighting off antivirals such as HIV, AIDS, or hepatitis C to not work properly and increase the toxicity for heart medications and anti-cancer drugs.
Provasic.
So this was interesting because it was actually accidentally published by the World Health Organization on their clinical trials database online. And it was a summary of the result of the trial, which was that it didn't have any effect on the patients and it didn't have effect on their condition or on their viral load. That's been confirmed that was true by the World Health Organization and by Gilead. But the questions really are, what does the details lower down from the trial tell us in terms of maybe there was some subset of patients that did benefit? And also, is there any more information that they will give us when they finally publish that under peer review?
There was one thing that's been thrown around, Hannah, since this came out, that to downplay perhaps whether we should be extrapolating too much from this trial, which was that there weren't enough people in it or that there were no control functions. Can you tell us more about that and whether we should be discounting anything at all from this?
So there actually was a control arm in this study, and in fact, this was the first randomized control trial for the drug, which is why people were watching for it. One thing to bear in mind is that it didn't actually finish. One of the difficulties of doing trials in these situations is that they started this trial in China when actually there was a lot of coronavirus patients. There aren't so many coronavirus patients now, so they didn't actually finish enrolling it. So that's worth bearing in mind.
Provasic.
The World Health Organization could not be any clearer in its advice today. It does not recommend the use of antiviral drug Remdesivir to treat hospitalized coronavirus patients, no matter how sick they are. The warning comes as part of the organization's regular review into COVID-19 treatments. It says its findings indicate that the drug doesn't help improve survival rates or reduce the need for medical ventilation in patients with breathing difficulties. The announcement will prompt some awkward questions for health officials in the United States, who just over a month ago approved the use of Remdesivir for sick coronavirus patients. The maker of the drug, GILEAD, had earlier applied for emergency use of Remdesivir to America's Food and Drug Administration. That application was approved, and since then, some hospitalized patients have been receiving the medicine as part of their treatment.
Provasic.
So they finally decided to go ahead and admit me, and the doctor came in. I saw her that morning, and she basically told me was that, yeah, we're going to go ahead and start some Remdesivir on you and start you on a steroid for 10 days. And the Remdesivir was a 5-day run. And we started the Remdesivir, and it went in okay. I didn't have any issues with the medicine after the first dose or so. But I will tell you, after the second and going into the third dose, my sats start dropping. I mean, I went from just on a simple mask, simple Venturi mask that was producing like 6 meters. I went from that to a high flow nasal cannula and a non-rebreather combined on its maximum output to maintain a 90% oxygen saturation. And even that was difficult to maintain. I was probably in the higher 80s with the high flow nasal cannula and the non-rebreather on at the same time.
August 8th, right? August 8th, you started it?
Yeah.
August 7th or 8th. And I can also, yeah, the day after he got admitted.
Get it in there fast, yeah.
From the outsider, like he's telling you from the insider's perspective, from the outsider's perspective, I can tell you he got his dose of Remdesivir in the evening. And I know that for a fact. Since then, we've gotten his medical records and we've confirmed that. But I would talk to him in the morning and he would be like, that morning I talked to him before his first dose, he was just on a simple nasal cannula like you see him on now. He got his dose of Remdesivir. That next morning, he was on a face mask. His second dose of Remdesivir, he was on a non-rebreather. His third dose of Remdesivir, he went to a high flow nasal cannula. His fourth dose of Remdesivir and fifth dose of Remdesivir, he went from a high flow nasal cannula, increasing all the way up to the maximum concentration that they could give him oxygen with a non-rebreather on top of it. So it was like I would talk to him during the day and he'd be fine. He'd get his Remdesivir. I'd talk to him the next day and he's on more oxygen and he's just slowly declining.
I don't understand why they keep going if they see it's declining.
Yeah, it didn't make sense.
Provasic.